Hello everyone. I would just like to provide a little bit of more information on what to expect in an ADHD assessment with us at Attention to Health. For us, doing a really comprehensive and detailed assessment is so important when trying to find out whether ADHD is a good fit for somebody's presentation and what their main issues are. We pride ourselves on doing a very thorough assessment, not only looking at whether ADHD might be sort of the explanation for what someone might be going through, but also looking at all the other possible differential diagnosis, we call it. So be that maybe another mental health problem, something coming out of maybe another neurodevelopmental condition, for example, autism, or the specific learning difficulty such as dyspraxia, dyslexia. But also thinking about somebody's history and how that may have shaped their kind of personality and what that might be contributing to the picture. For us, an assessment typically lasts 2 to 3 hours. That involves talking to a clinician in detail and then also talking to sort of somebody who knew you well. So sometimes this is a friend or family member. Sometimes it's also somebody who knew you really well as a child. That's so important when really understanding how these difficulties could have affected you throughout your whole life and really whether ADHD makes sense as an explanation. After having that kind of discussion, we then always, unless that it's very clear what the problem is, have what's called a multidisciplinary discussion. So that's where the clinician that you spoke to will talk to their colleagues and get their opinion on what the sort of the presenting problems are. So with us, you not only get the opinion of one doctor, you usually get 3 or 4 as well. And all of those things are considered. That's how we do things here. If you have any more questions, do look at our further information.